I was 5.5 months pregnant. Everybody said spotting was regular for pregnant women, but obviously I didn't want to take any chances, so I went to the ER. They actually said to me, "We can't let you go home. You are dilated, we need to hospitalize you immediately." I had to call my husband and say, "I'm in the hospital and I'm staying." I was 2 weeks shy of the 24-week period before they consider a baby viable, and I had to hold on minimum for 2 weeks.
The night that this happened, she started to have trouble breathing, and I panicked, and I went into the hallway and I started yelling for anyone that would come and help us. And then they saw that her heart rate started to drop, baby's heart rate started to drop. And they said, "We need to do emergency C-section." She was basically in a coma. They said, "There's very little we can do but hope." There is one hospital that can help, and that was New York-Presbyterian.
When they called us, they were really just calling for help because there was nothing left to do. I called Dr. Bacchetta, who was living outside the city at the time, and I said, "Matt, get in your car." And then I hung up. I activated the team, and then about 10 minutes later I called him, and sure enough, he was in his car. He actually didn't know where he was driving, and we discussed the case. And during the C-section, amniotic fluid got into her bloodstream and caused her to go into cardiac arrest and to bleed profusely, not just from the site of the C-section, but everywhere throughout her body.
When we got there, she barely had a blood pressure. Her oxygen level was barely recordable and very, very close to just dying. I explained the situation to her family as best as I could, and then we immediately started working.
When we put people on ECMO, they're very, very sick. And then there's Lizzie. Lizzie was already dead, or mostly dead.
I even asked Matt, Dr. Bacchetta, what are we doing? Because she didn't look like she was even alive. And he said, "Jules, we gotta try. We have to try. We have to give her every chance."
We performed emergency cannulation to get her on the ECMO device, and that helped restore her vital signs to an extent. However, the device flow started to decrease fairly quickly.
Dr. Bacchetta said, "I'm going to have to perform an operation on her. She seems to be bleeding into her body. You're our only hope, so do what you have to."
Dr. Bacchetta's training as a trauma surgeon in the military came in handy because he was able to open up her belly, take out 3 liters of blood.
As soon as we did that, the blood flow in the device picked up and her vital signs were restored. I still had to caution the family that her condition was quite grave and that we had a long road ahead of us.
Her heart actually, by the time she got up here, had completely stopped. Her lungs were non-functioning. Her kidneys weren't functioning well, neither was her liver, and she was bleeding profusely from everywhere because she couldn't clot blood. She was completely and utterly dependent on the ECMO for her survival at that point.
Dr. Brodie said she's the sickest patient in the hospital that we have by far.
The support system that we needed is here at New-York-Presbyterian Columbia.
Within a few hours, she probably had about 10 or 15 doctors sort of like crowded around her.
These patients are so complex that unless you have a complete team, along with all of the infrastructure to do it, you can't manage them successfully.
When she was on ECMO in the ICU, we had discussions with the family several times a day because it was really a moment-to-moment situation.
We were not completely sure about her brain activity. It just became a waiting game for us, but for the doctors, it was substantially more than that.
There were 2 stories unfolding at the same time. We were also concerned still with Leo.
He was tiny, like fit in the palm of my hand.
The first morning I saw him, we were evaluating him for need for ligation. The family was very, very distressed. This was new information, they were getting it, and Mom was still very sick.
To have me at the same time in the ICU and him in the NICU, it just shredded them. To be back and forth every day between the 2 ICUs.
And just understood what they were going through, knowing that in the end, they could end up going home with nothing.
It's very hard to ignore the fact that if we didn't save her, that there would be a child who didn't have a mother.
My goal was, after he had gone through the PDA surgery, come off the ventilator, and back on CPAP was to see if I could get him over to a 4-figure birth weight in about 1 kilogram. And by the end of my first rotation with him, taking care of him, we were able to achieve that.
When I woke up, I didn't even know I had given birth.
Yeah, you have family. You have a baby and a mommy.
Her recovery was pretty remarkable, going from a point of not having virtually any organ function to within about a week and a half, most of her organs returning to at least reasonable function, and then from there she took off.
I've had all these visitors and everybody coming by and saying, "Oh my God, you're sitting down, you're talking," and I'm like, what happened?
Mom made a miraculous recovery. She was discharged, and I still remember anxious moment because she didn't see him until he was about a month old.
I do remember the first time that Elizabeth saw Leo, and I just wanted to cry. I did cry. It was a walking miracle.
You were very brave together. You were super brave. Okay, here we go.
And when he came in, he was only 1.5 pounds. He fit in the palm of your hand. Now he's 9 pounds, coming home.
To see him come from an isolette where he was barely a kilo to now jumping and trying to crawl is very rewarding.
My first reaction looking at him, it's all worth it. This is why we do it. Leo's going to do very well and continue to prosper.
The team that was required for her survival is very large and carries a lot of expertise from a lot of fields. And it's the only reason that she was able to survive. That and the fact that she had an incredible will to live.
I'm just really happy to be part of a team like this, that it shows that once we work as a group, it shows what kind of miracles we can make over here in York-Presbyterian.
It became more than just a hospital. You end up with a sort of an extended family. That was a wonderful, wonderful feeling.
Yeah, that's really well said. The biggest blessing I have is being alive. What limitations do I have? I have nothing, thanks to New York-Presbyterian.